mentioned in the chat that we are getting ready to start. We have an overwhelming response to this webinar. We had close to 100 people registering, so we're just moving all of our registrants into the waiting room. Please just keep your eye on the chat on the right-hand side of your screen. Please share, just jump in and share where you're from. We'd love to hear where you are located, what your job is involving, if you're someone from the community, a patient. It would be a good opportunity for all of us to meet someone new today. And just give us a couple minutes as we just move everyone into the webinar. We're at 61 right now. Like I said, we've had close to 95 registered, which is great. Thank you for your interest, and we will start shortly.
Jill, always funny. Yes, we're learning
without humor.
I love this. Yeah, we're all learning about new ways of doing virtual connections. All right, hello, Aaliyah. Oh, nice to meet you. Oh, I feel like, did we meet before with the CDC grant? Since you're with AHC? That's great. We have Chicago in the house. Gilead's in the house. Who else is here? Virginia.
Virginia, very nice.
Virginia. All right, now we have more people. All right, you guys should, I don't know if everybody knows how to use the chat. You should see it kind of pop up with a number below if you haven't checked your chat. Colorado, excellent.
I see Amy, our new pharmacist, is on as well.
Oh, great. All right, we're getting some traction. Maryland's here. Jersey City, hello. Ohio, that's awesome. I believe there was a, oh, hi, Jackie. New York City Health Department, awesome. Hi, Michael. Claudia Ortiz, hello. Oh, we got a nice spread of people. All right, so yeah, a lot of these people I think we know from our New Jersey Hepatitis Coalition. So this is great to see so many
Curtis
people.
From Gilead. Hi, Curtis.
Oh, great. Oh, hi, Curtis. Canada, we're international now. No, this is very exciting. We thought this was just going to be a New Jersey thing, but it looks like we've got a wider reach than that. All right, well, Ruth, why don't we get started and everybody can keep saying hi to each other on the chat.
Yes, we promised that we would start at 3:05 because we all recognize your time. And again, thank you so much for joining us. Welcome to Hepatitis B and C in the midst of COVID-19. My name is Ruth Brogdon. I am the program manager here at the Center for Asian Health and the program manager for the Liver Center here. Today is very exciting. Today is May 19th, Hepatitis Testing Day. And May also being Hepatitis Awareness Month, we're very glad to bring this webinar to all of you. I encourage you to visit the CDC's Hepatitis Awareness page, which summarizes the ABCs of viral hepatitis and where each week new content is featured. During Hepatitis Awareness Month here at the Center for Asian Health, our goal is to engage the community in becoming aware of their status by promoting testing services and vaccination services, as well as educate and inform the public on treatment and care options. But of course, with COVID-19 in the background, there are many considerations to take into place as we encourage our population to know their hepatitis status and seek treatment and care. So with that in mind, I'm very, very excited to have our team here from the Center of Asian Health to take you through each component of viral hepatitis identification, care, and treatment. The Center for Asian Health is a primary care outpatient practice at St. Barnabas Medical Center here in Livingston, New Jersey, which is part of the RWJ Barnabas Healthcare System. Before we start, I'm just going to give you a couple of housekeeping items. As you have noticed, Everyone is on mute, but we encourage all of you to please send in your questions as we go along. And at the end of the session, we will go through those questions, as many as we can, as best as possible. So now I'd like to introduce our first speaker, Dr. Sue Wang. Dr. Sue Wang is the medical director here at the Center for Asian Health at St. Barnabas Medical Center. She is board certified in internal medicine, primarily specializing in adult primary care. Not only is she a highly respected local and state leader in the area of viral hepatitis, but she also serves on the global stage as the president of the World Hepatitis Alliance. She has dedicated her career to advancing Asian health and wellness with the focus of hepatitis B identification and treatment. It is my pleasure to introduce Dr. Sue Wang. Dr.
Thanks,
Wang?
Ruth. Thank you so much. Thanks for that great introduction to our whole topic. We're glad to be here today to share our experience with you. There is a lot going on, obviously, with COVID, and I think what we are all mindful of is how does this impact the community, our patients who are at risk for hepatitis, our patients with hepatitis. And while we don't have all the answers and the medical community is still trying to figure out best approaches, it's very useful, I think, in times like this for us to communicate, really to share experiences, to learn from each other, to hear from patients, to hear from the frontline workers. And so we hope we are able to give you a little perspective from our angle. And I'm excited, especially that it's not just going to be like a boring doctor talk like a lot of talks, but that we will have our team here, which is a pharmacist, and our navigators to really share some of the work that they do as part of hepatitis for hepatitis care. So let me advance my slides. So I don't know where the circle came from. All right, well, we will just try to go through this. Oh, thank you. All right, so just in our region, so we're New Jersey, New York area, which you all know has kind of become the epicenter for COVID in the US. And this picture just kind of really highlights the intensity of what we're seeing in terms of the number of cases. So we're all living this, obviously, and we just know it's been a constant onslaught of information and change every single day. But when you take a step back, you look at just our area, our first cases of COVID were found March 1st in New York, and then just a couple of days later, March 4th. And when I think about the rapid amount of change and adjustments in life and our work, the way we work, the way we provide medical care, it's hard to imagine it's really just been 10 weeks since this all hit. And here we are talking about 27, almost 28,000 deaths in New York, 10,000. We crossed the 10,000 mark for New Jersey over the weekend, which is just really, just really hard to believe. And, from a year ago, from even just a couple months ago, to imagine we would be in the midst of this. So this is the map of the US. And so, I think we've seen this firsthand, and we hope that many of you in other regions, won't get hit as hard as we are, but all of us are getting hit with a lot of the social distancing measures, and what that means on our lives has an impact for everybody. So this is something that New Jersey has on their health department page, and I'm sure a lot of you have something similar, but this is our data dashboard. So shout out for our health department for putting something as useful as this that really helps us track the epidemic in our own state by regions and by hospitalizations. And this is just one of the snapshots. There's also one that showcases the demographics of those people with COVID, associated diseases, which I think is very interesting, looking at the number of people with diabetes, hypertension, other comorbidities. So the data obviously is incredibly important for knowing how to make good decisions. And you can tell that our peak was April 12th and our numbers are declining day by day, which is very reassuring to hear, and has also led to a gradual opening of our state with, on the medical side, elective surgery starting next week. And I'm sure some of you are seeing those steps of reopening as well. So, and as part of those steps, really, we've all heard all about flattening the curve, social distancing. I had found these great infographics from health departments, and I wanted to give a shout out to all the health departments who are here, because you guys are really the link to informing the public, and a lot of the materials that you make It's really, really critical for getting good information out to the public. And you can see some of these things from Utah, from Colorado. There's one from Indiana that I found, and I think these things are really helpful. And it's good to, borrow, I think, from other locations too, rather than recreating the wheel. So, the whole goal, of course, of social distancing was really slowing down the spread without exhausting our healthcare capacity. And so we've certainly seen that in some areas better than others. But that is the goal. And so as part of that, what has the healthcare response been, right? So as what Ruth was saying, we are a primary outpatient clinic. So while we have not been battling patients with battling COVID on the front line in terms of ventilators and inpatient patients, we've been seeing them calling us, seeing them in our offices, to screening them. We were doing parking lot testing for a little while. And so how does it look? Our efforts to do social distancing while also providing care to patients, right? We're all straddling that fine line of providing services while also keeping our staff and our patients safe. So telehealth has become a real central part of our COVID response. As I said, it's to reduce exposure of patients and our staff. The other big thing is really just to reduce PPE use. We had a severe shortage of supplies in our area and really needed to prioritize the inpatient and the ED settings. And the policy had become, after a few weeks of COVID, that all staff and all patients, anybody in the building, needed to have a mask. And N95 for those who were suspected to have COVID. Doctors needed to have it. So that became a real limitation. And it still is a very tenuous situation in terms of supply. So still a big part of our decision-making in terms of being able to open up to in-person visits. So, and obviously we wanted to be able to continue medical care, right? We don't want to shut down. We wanted to be able to still access our patients and provide them medical care, even if remotely. So who have we been using telehealth for? So for both existing and new patients, the CMS lifted a lot of the restrictions. It used to be that you could only do telehealth for existing patients. A lot of these has been lifted so we can see new patients, we can see patients with chronic diseases. And this is really something we emphasize, and we've done active outreach because we know that patients with certain diseases, hypertension, heart disease, diabetes, are also more at risk of getting more severe coronavirus. And so we also wanted to make sure that our patients felt okay and that they were continuing management of their disease with medications, getting their refills, so that they were not more susceptible to getting COVID. We can actually do annual wellness visits through this. It's obviously the major limitation is not being able to do an in-person physical exam. And what we've told patients is, we can do the history taking, we can do a lot of the talking part, and actually quite a lot of the visualization. And what we've learned as physicians is we feel like this is kind of like a virtual home visit now we're doing with patients, where we're going into their house by being able to see what their environment is. And it's actually been very eye-opening in terms of feeling a certain level of intimacy with our patients that we haven't had, because they always come to our space and now we're going into their space. But the one part that we do want them to do is come back in a couple months for an actual good physical exam. But besides that, we can at least do parts of the annual wellness visit. So, and the last part is obviously being able to evaluate patients who are with suspected COVID remotely is actually a really important to decrease chance of them bringing it to an outpatient setting, and to be able to manage them at home as much as we can. If they are not having severe or moderately severe COVID, we can actually manage them at home and walk them through it. And even for discharges, we've actually helped manage a lot of patients once discharged from the hospital or the ED. They may be discharged with oxygen or pulse oximeter. And so telehealth is really important for checking in with patients daily or regularly, just to make sure they stay on the path to recovery. So in terms of what's happening next as we open up, so we do plan on accommodating in-person visits soon. For now, it's case by case, but I'm anticipating by June we should have a schedule which will look very different from before, because we'll still really be prioritizing safety with strict physical distancing measures. Our waiting rooms will be empty. We're going to try not to use our waiting rooms. We'll still be limiting time in the rooms. Patients will call from the parking lot to let us know that they're. We're going to try to do check-in, check-out remotely if possible. We'll be doing screenings, like a lot of places with thermometers, and obviously clean, good disinfection measures for all of our shared areas. So in the meantime, though, and throughout this crisis, the laboratories and radiology sites have been available. And obviously observing a lot of these physical distancing and safety measures. And so we assure patients that, now you call, you don't just walk in, but they're still able to get these important services. So, but one of the complications, which we're hearing more and more about, is what does this mean for medical care? Because obviously a lot of people have delayed their medical care. Our volumes have dropped a lot. Emergency room volumes have dropped. And so what you're seeing is that people are actually so afraid of the virus that they are willing to wait out whatever medical issues that they have. And so there's a real concern that we're going to have a disease surge. There was one article that cited that this is from the CDC, that actually just the first quarter of this year, we've had 66,000 more deaths than expected, than compared to last year. And only half of those are directly linked to COVID. So we know, of course, there are some people who are, dying of COVID who may not be diagnosed as such, especially if they're dying at home. But there are a lot of people also suffering from diseases that could have been saved if they had gotten care earlier. So this is a real concern. And then the survey here is actually a survey of physicians who were polled and saying that, yes, they actually believe that there will be a number of deaths that will occur because of delayed care in their patients. So, and this is a interesting diagram that I'm attributing to somebody on Twitter, Dr. Victor Chan, I believe, that kind of diagrams exactly what we're talking about. So the first wave was really the immediate mortality and morbidity of COVID. The second wave is, non-urgent things, not being able to get surgeries and things that are considered urgent, but non-COVID. And then in terms of chronic conditions, like people delaying some of their regular checkups, or for diabetes check, maybe not getting their blood work on the regular schedule, and we will have a surge of some complications that would have otherwise that could have been prevented. And then there's also this fourth wave, right, which we're talking about in terms of stress, anxiety, even suicides from the mental health burden of COVID. So, and just going further into that, some of the data, we're saying some of the surveys are showing that 30% of people are delaying medical care. Our ER volume is seeing the exact same trend, about 50% volume down. And people are saying, what happened to all the strokes and the heart attacks and the appendicitis that we would have seen? These things don't just go away because it's a pandemic. So it makes us very concerned that they'll either be much worse, or are people suffering at home and potentially passing away from these catastrophic events. So, and then for the hepatitis scene, we do worry about delayed cancer screening. So mammograms being delayed, means more late stage breast cancer. So for our hepatitis patients and people with chronic liver disease, we're thinking, are we going to see more cases of liver cancer, or delayed or late stage liver cancer? So now we're going to transition to kind of what is happening in our area with hepatitis. We had already been really trying to mount a response to fight what we had seen as really high rates of advanced liver cancer in our area in St. Barnabas Medical Center, our service area. So this is a report from one of the national oncology boards that showed that at our center, 16%, or nationally actually, 16% of liver center patients who are diagnosed at stage 4. So this is across all cancer centers. But at our cancer center, we are finding that our rates of stage 4 presentation of liver cancer were 29%, so much higher. So, and some of the reasons that we surmise are that people are not actually getting screened for conditions that can cause cancer, such as Hep B and Hep C, fatty liver, which we know is on the rise, and alcoholic cirrhosis. And then once they are diagnosed, that they aren't getting care to actually manage that condition and prevent them from developing inflammation and further leading to cirrhosis or other or cancer. So that's what our approach had been in terms of trying to decrease, try to identify more people. Finding the missing millions obviously is one of those approaches. And this is an effort that's coming out of the World Hepatitis Alliance, which I'm the president for the next 2 years. This is a 3-year campaign really talking about how important screening is, because 9 out of 10 people living with Hep B or Hep C have not yet been diagnosed and just haven't been tested. And I think what's interesting is that COVID has really brought to the forefront to everybody's mind just how important testing is to curb an epidemic, right? Everybody's been talking about the access of testing. You know, they've had all these drive-through testings. People have been waiting in their cars trying to get tests at these drive-through clinics, sometimes waiting from the night before. In our area, some of these locations had to close at noon because they were finished testing. So, you know, that was really the buzz we were, and the questions we were getting from patients: where do I get tested? How do I get tested? There was a limitation of reagents. And so I think what it does show people is that, you know, testing really is the first step to your approach to, you know, to an epidemic or a pandemic. So just historically, what have we done in terms of finding the missing millions for Hep B and Hep C? Our center launched in 2013 to reach the growing Asian population in New Jersey. New Jersey has the 4th highest Asian population in the US. We had started off with a special focus on Hep B with a lot of community events and screenings. We received a CDC grant in 2014 and 2017. We're one of 3 sites. One of the sites is on the phone with us, Asian Health Coalition in Chicago. And so we do a lot of focused community events as well, really focusing on the foreign-born community. And then following that, what we've been working on now has been our focus grant, which has been to test through automated mechanisms to do testing of Hep B and Hep C in the emergency room, which is where we started. And now we've been branching into the inpatient setting as well. So we found that automating it, you know, making it really systematic, not just, you know, training every doctor to order it, but building it into the system really had a phenomenal impact in terms of the number of people we could screen. So in 2019, last year, we started the Liver Center, which was a way to really link together all the important services for people with liver disease. So we brought in a hepatologist who's part-time, and we kind of linked together services that already existed within our healthcare system and with our hospital. And this is something I say to other people, is that sometimes it really helps for patients just for you to be able to package it to them. Otherwise, just trying to navigate our healthcare system in the US can be very overwhelming, and having navigators, or even us having physically just kind of map out a program for patients is really helpful for them to be identified, get care, and have the best outcome. So transitions of care we talk about a lot. I know in the hospital there's a lot of focus on like CHF, like heart failure transitions of care, and we feel like this is really important. We need to bring it down to the hepatitis and the liver world also. I'm going to have our navigator and our pharmacist will talk a little bit more about this, but this just kind of shows you how important it is the handoffs are. So for us, we're doing all this screening in the emergency department, but what happens upon discharge, right? Who follows up with the patient? So our navigator is key for doing that handoff from the emergency department to their follow-up care, which could be either primary care physician or another provider. And once they're in that kind of setting, then continuing our team approach with the navigator, with the physicians, and with our pharmacists to make sure those patients stay in care has been a really critical part of our program. So you see us here doing one of our biweekly case conference meetings with our team. So in terms of just what our practice looks like, so people don't think that we are, we started off doing all this is all we do, but we're actually primary care. So we have 4 internal medicine physicians who do the regular internal medicine stuff: diabetes, hypertension, toenail fungus, whatever it is. And then we also have been doing, because we started off with doing work with the Asian population, that became one of our niches, is to provide Hep B care, evaluation, and treatment. And then with the advent of the new DAAs, which are much more simple for treatment in an outpatient setting, we started doing Hep C care last year. So what I tell people is, if we can learn, this is definitely something other primary care providers can learn. And there's a lot of training and education and resources out there. And it's just, what's amazing is that we are able to offer this very important thing for patients, this hope that their Hep C can be cured, in most cases as short as 8 to 12 weeks. So our navigators and our pharmacists are a part of our team, and then the hepatologist. So what have we been doing being able to do during COVID? So for our established patients with Hep B and Hep C, we really encourage them to continue their regular schedule of checkups. And of course, it's a telehealth right now, but it's just checking on them, making sure that they don't have any new symptoms that we need to address, that if they are on medication, that they're able to continue to get their medication. For blood work and imaging, obviously there's some hesitancy with getting it, and we do tell them that that it is okay if they delay it. And what the AASLD says, arbitrarily, they're saying, delaying 2 months is okay as long as the patients are stable and there's nothing urgent that needs to be addressed. For our automated programs, because they are automated, they actually continue happening at our hospital. Currently, the recommendation is not to initiate treatment while somebody's in the middle of getting treatment for COVID. And Jamie will talk a little bit about what it's been like to reach out to patients who, or how she handles patients that are getting identified while they're also in the hospital with COVID. And then we work closely with patients. I think this is the most important thing. Every patient's situation is going to be different. And what we offer is really a tailored approach. Sometimes she'll even say, I'll call you every 2 weeks. You tell me, when you're ready. And sometimes, they're ready when you least expect. So in terms of what does COVID mean for hepatitis patients? So we get a lot of questions like this in terms of, am I considered really high at risk? Should I, really even more so avoid going out? And currently there's no evidence that having Hep B or Hep C, at least if you're compensated and not cirrhotic, but if you have stable Hep B or Hep C, that it actually, it does not increase your risk of getting COVID or having more severe COVID disease. However, if you have Hep B or Hep C and you have other risk factors such as obesity, fatty liver, diabetes, heart disease, and hypertension, those things can make you at more risk. And so we're really trying to emphasize to our patients is really important for you to continue management of your other medications. And if you're on medications, to continue taking those medications, not to drop them or not to stop your other medical care. And COVID-19 can lead to liver enzyme elevation, and 14 to 53% is what has been observed, but it does not seem at this point to necessarily be a flare of the hepatitis, but more manifestation of the inflammation from the disease from COVID itself. So of note though, people who do have COVID and may be getting treatments, some of these treatments such as remdesivir or some of the immunomodulators, those can lead to liver enzyme elevation, and we have, that is something to be considered because some of these will suppress the immune system. So if you have Hep B, there is a risk of potential reactivation. So that's something that doctors should be aware of when they start those medications. So as many of you know, we thought it was just a lung disease, but it's really turning out to be a multi-organ disease, COVID, affecting many, many parts of the body. And we're finding out more and more about it in adults and in kids. And as I mentioned with the liver, that there are some, data showing that the liver can suffer some inflammation as well. So what's interesting is really taking lessons from COVID and seeing how it applies to hepatitis or vice versa. Things that we've learned in hepatitis, I think, are actually quite informative for the COVID approach. And as I mentioned, really, I think we're all realizing how important access to testing is. If you can't diagnose people with the infection, you can't stop an epidemic. And so testing for Hep B and Hep C is critical as well, just as testing for COVID is. So we need reliable, accurate testing. We've seen all this attention about this FDA emergency use approval and how, this is not the typical way of getting test approval. And so there's been, not all the tests are created the same, and some have really low sensitivities. And so there's a number of people who are getting tested and have false negatives. And you hear about, tests entering the market that have not even gotten the FDA EUA approval. So all this hubbub just kind of makes me want to remind people, hey, we actually have Hep B and Hep C testings that have tests that are well vetted. There's a lot of data and research behind them. The sensitivity specificity is like 99 to 100% for these tests. Hep C, as we know, is a two-step test, and the Hep C antibody, the initial screening test, can be done as a point of care test, followed up with an RNA for confirmation. For Hep B right now, it is a blood test. Though, as some of you know, there are actually rapid Hep B tests available as well, but not in the US. And I would love to advocate, after all this COVID stuff, to say, hey, if we were able to get COVID tests in home, why can't we get Hep B testing done in home as well, and Hep C, because that would really decrease the barrier for testing for a lot of people. So, and as we learned about COVID, people who are asymptomatic can have the infection, and it's the same thing for Hep B and Hep C. So really prevention, what we've learned for COVID, because we don't yet have the medications that have been, gone through rigorous trials yet. Prevention has been key to curbing the epidemic, everything about social distancing, hand washing, PPE. We don't yet have a vaccine. That's what everybody's hoping for COVID. For Hep B and Hep C, we know the transmission routes. We know it's bloodborne, it's not the casual contact. We have many prevention strategies, such as harm reduction, blood screening, vaccines. The vaccine is really the game changer for Hep B. So you think about how desperate people are for the COVID vaccine, and if there were a vaccine, we know people would be in line for it. And yet we've had this Hep B vaccine for how long, right? And still there are quite a number of adults who have not been vaccinated. So that's something we should be pushing for. And then lastly, effective medication can change the course of disease and give hope. So for COVID, we don't yet know what works. A lot of clinical trials are in process. Whereas when we look at Hep C, we have amazing medications that can actually cure Hep C. They're oral, they're short courses, 8 to 12 weeks. Our patients, feel like they start the medicine and in a blink of an eye, they're finished, and it's over 95% cure rate. So there's no reason anybody who has Hep C should not get started on treatment. For Hep B, we don't yet have a cure, but we do have oral medications that can suppress the viral load, but they have to be taken long-term. And it is hopeful, because we do have a number of trials for a cure that are in process. So we are, even though we're not having events for National Hepatitis Testing Day like we would like, we still are offering free screening. And while people may not be looking to get blood work done right away, but we do say, if you're getting blood work done for anything else, so some people will be getting COVID antibody testing at some point for your physical or for pre-op, really consider adding on the Hep B or the Hep C screening to it. I was reminded that, at some point we really should add Hep A to our list, because we're in the middle of a Hep A epidemic in the US as well. And so I would encourage, get your ABCs all tested for. And that would be, our main message for Hepatitis Testing Day. And we'll have the slides available, but just so everybody knows, there are a lot of really good resources out there between CDC, the World Hepatitis Alliance, ASLD, and EASL. This is the CDC just posted this last week, what to know about liver disease and COVID, so definitely make that available to your community. And EASL has a really good one in terms of how to handle healthcare for people with chronic liver disease. So, so with that, I'm going to pass this on to our next speaker. Ruth, you want to do the transition, or I guess
yes,
it's Jamie.
Yep, sure. Dr. Wang, thank you very much on that presentation of hepatitis and COVID. Definitely lessons learned from each one of the epidemics. As Dr. Wang mentioned regarding our transition of care, I'd like to introduce Jamie Yango. She's part of our patient navigation services here at St. Barnabas Medical Center. And we've seen that with the patient navigation services, we've had great success in making that an initial link and assisting in that continuum of services, that package deal Dr. Wang had mentioned. I'm very excited to introduce Jamie Yango. She is one of our viral hepatitis patient navigators for the hepatitis screening program here at St. Barnabas Medical Center. She navigates hepatitis positive patients to their initial care visit here at our practice, and then assists them with appropriate follow-up care. Jamie?
Thank you, Ruth. Hi, I'm Jamie. I'm the viral hepatitis patient navigator. As a patient navigator, I provide basic education on hepatitis B and hepatitis C, and I help with follow-up care, as Ruth has stated. So if a patient screens positive in the hospital for hepatitis B or hepatitis C, I link them with one of our doctors in the practice. We also help patients who may have been previously diagnosed and who have not received treatment to get them into our office with the doctors. And for those who have never been screened before or don't have a diagnosis, as Dr. Wang had mentioned, we do have the free screenings for hepatitis B and hepatitis C at our outpatient facility. So in the midst of COVID, what we've been doing is we've been waiting until patients have been discharged from the hospital, because we know that COVID is, on the forefront. And we in the inpatient side, we'll look at the charts, we'll make sure that they're still there, and until they're discharged, we don't reach out to the patient. But there have been some patients who get discharged, and after they've been discharged, we call them to see how they're doing, and we basically feel out how they're feeling in terms of their COVID, so that we can ease into letting them know of their diagnosis of hepatitis. And then after that, we schedule the appointment with our telehealth. We'll schedule telehealth appointments with our doctors, where the doctors provide consultations. They do assessments. They go over screening results. They do additional blood work and any appropriate studies. And after the appointment, we do ask for patients to complete the necessary blood work as soon as they can, so that we can start the process of treatment. We call our patients to let them know of their results or any recommendations of next steps. And we always make sure that our patients provide us with the preferred contact phone number to make sure that we can reach them. And for those who do need treatment, we ask them to come in for another appointment so that they could speak with the pharmacy team. So our pharmacy team and patient navigators, we are always happy to assist along the way.
Thank you, Jamie.
Thank you.
Our next speaker is Alyssa Galapani. She is going to talk to us about the treatment of viral hepatitis during COVID-19. Alyssa Galapani is a clinical assistant professor of pharmacy practice at Fairleigh Dickinson University School of Pharmacy. She is also an ambulatory care specialist at RWJ Barnabas Health in 2 office practices. Alyssa precepts pharmacy students and residents to extend expertise in medication management in the office setting. Please join me in welcoming Dr. Alyssa Galapani. Alyssa?
Thank you, Ruth. So while I'm waiting for the slides to come up, our role is pretty atypical for a lot of other office practices. I'm fortunate to be able to practice in such a collaborative setting with different providers, as well as medical residents, pharmacy residents, and students. So thank you very much for having me. So during the COVID-19 epidemic, really the main lesson that we want to educate our patients on now is to continue their current treatment if they're being treated already for viral hepatitis. As the pharmacist, really we have a couple roles. We want to keep our patients healthy right now and keep them out of the hospital if possible. So for that reason, myself, my students, and my residents have been performing outreach either telephonically or through telemedicine to make sure that our patients stay healthy and continue on their current treatment if they are on any, especially right now for hepatitis B and C. We also encourage patients and help them in the process of refilling medications, because right now this is a very difficult time for many. So they may be approaching their refill dates quicker than they anticipate, or when they're due for a medication refill and are attempting to avoid the pharmacy or going to the store, we also assist in ways to overcome those boundaries, such as helping them identify mail order pharmacies. And just like any other individual during these times, we really stress the importance of taking care to prevent COVID-19 infection. So again, if we have elderly patients that we're following up with, or individuals who may be immunosuppressed or at high risk of acquiring the infection, then again, we'll really work closely with them to help them continue their medications at home while maintaining a safe distance. For those who are diagnosed with COVID-19 at this time, we also encourage them to continue liver medication if they are currently on it. We also encourage individuals to have a up-to-date medication list if possible, especially during these times if they can carry it around with them or place it in their wallet or in a phone app. So then that way, God forbid, they are in the emergency room or hospitalized, the care team can know that they are on medication for their hepatitis and can continue on an inpatient setting. And for those who may be concerned about starting new medications, I think Dr. Wang really hit the point home earlier that now's not the time for individuals to feel like they have to delay their care. Patients can still get care if they are willing to start liver medication, whether that's for hepatitis B or C. They do have many resources within our practice that we'll discuss on the next couple of slides. But just to know that they have a team here that is ready to help them and walk them through the process if they do choose to start a new medication. There are also concerns about affordability of medications, particularly due to the high unemployment rates and individuals who may be furloughed or having pay cuts. So again, another benefit of having a pharmacist or residents in our practice is that we can help individuals identify where the most affordable medications are, whether that's through copay programs, coupons, or copay assistance programs. So we work with them to make sure that if starting a medication or continuing medication is pertinent to their care, that they can continue that without avoiding care. So I'm going to pass it on to Vasil for the next slide. He is a pharmacy resident on rotation with me, and he will explain the different roles that the individuals in our practice have and how we can work together to make sure that patients get the treatment that they need. And then we also have pharmacy students as well. So really a complete team here.
Hi everyone, and thank you. Now, what if you do need viral hepatitis treatment, and who will be there for you? And we as a team work together to be there for you. So we have our doctors, specialists, pharmacists, patient navigators are all there to get you the treatment that you need. And our doctors are there to perform the exam, order the appropriate labs, and really communicate with you and the other doctors to coordinate the care. We also have a liver specialist within our clinic who focuses specifically on liver disease. And they will be there to assist you through the different assessments that they may require you to perform, the tests, the imaging as well. And then, just as Elisa mentioned, we have our pharmacists in the clinic, and they go through your medications one by one to really make sure that you know everything about your medication, why you're taking it, how you should be taking it, and all the details such as side effects. And they also review your medications to really prevent any drug interactions from happening and making sure that the treatment is safe. And they can also help potentially lower the cost of your medications through the numerous resources that they have available to them. And then lastly, we have the patient navigators to really tie the care together in helping manage your appointment times, communication with your doctors, and then linking care with the other providers that you may have at the time. Next slide. Thank you. And so as you're going through treatment, what can you expect? The steps are straightforward, so let's walk through them. So the patient navigator will help schedule a virtual appointment during the time of the pandemic, since we don't have in-person appointments, and they will fill out any paperwork needed. Then you will see your doctor through a virtual visit and then you will follow up with lab work at our office. Our staff have precautions in place to minimize your risk, such as scheduling blocks for patients to come and get their blood work. And this helps minimize contact with other patients potentially and really protect you and have your safety in mind. Once the labs are back, your doctor will review them with you and go over them and what the results mean for you. Then the pharmacist and the doctor will come together and really choose the best treatment for you depending on what needs to be treated and affordability at the same time, as well as keeping safety in mind. The pharmacist then will review everything, such as your medications, how to take the medication, when to take it, and any side effects that you may expect. And then we will follow up with you to make sure we are there for you and help answer any questions that you may have throughout the treatment. Your doctor then will also follow up on scheduled visits to make sure that your treatment is going well with no issues.
Great. Thanks, team. That was really good. We do have a few minutes for questions. If anybody wants to type them in, we'll take those. I just want to thank, all of our team members for really being a part of this. It's been interesting working remotely, as many of you have, and we found that it's been very helpful to have like daily meetings to check in, to share about specific patients, or just talk about what's happening in our area in terms of COVID or what's happening with the hospital. As I mentioned, we have 4 doctors total. Dr. Zhai is actually here, Elaine Zhai, you can see her in the red. So we work as a team, and so she speaks Chinese, and we have another doctor that speaks Taiwanese and another doctor that speaks Korean. So as you can tell, we're tailored for the Asian community, but that's only about 2/3 of our population, and we actually see any kinds of any patients. And so if you have any patients in the area or want to collaborate with us, we're definitely very open. We had a big hepatitis summit last year in New Jersey. Thankfully, that happened before all this, because there's no way we would have been able to have another meeting with 90 or 100 people that we had there nowadays. But we launched the New Jersey Hepatitis Elimination Strategy. It was supposed to come out today or in May as part of May Hepatitis Awareness Month. We were going to launch the actual Hepatitis New Jersey Elimination Strategy, which has been delayed since everybody's busy with the COVID response. But we do look forward to continuing to work with our partners to eliminate hepatitis. And we work really closely with the health departments. I really appreciate all the state health departments here. That screening coupon I showed, we actually get funding from the health department, which comes from CDC, to do screening. And so I encourage any of you who are doing work in the community to really work together with your health departments, because there's a lot we can do together. So Jill Dennis-Clar asked, have you heard of any delays? Oh, wait, where did it go? Have you heard of any delays for women in prenatal care or issues regarding pregnant women and their Hep B status? I think anecdotally, we have not been seeing as many Hep B cases coming into the health department or pregnancy reports per a lot of coordinators. So that is really interesting. I mean, we definitely, obviously people are having babies and babies are getting delivered, on their, regular timeline. So I think it's interesting that you would see fewer positive reports of Hep B from, because those are just lab generated reports that I think the health department would get. I could see potentially that people who are identified with Hep B, pregnant women, are not necessarily going for the testing. Like that may have slowed down, right? If they were supposed to see a MFM, maternal fetal medicine specialist or hepatologist, potentially this could be a barrier where people aren't getting that specialized care, and that would be very concerning. So this is something we should highlight as well. I think that, it's an important part of making sure pregnant moms who have Hep B get their viral load done so that they know whether they need to be on tenofovir and to make sure that the babies get the vaccines. So yeah, there are a lot of potential barriers. I think even completing the vaccines sometimes can be an issue. And then in terms of some of these other questions, we won't be able to answer all of them because we have a 4 o'clock Chinese version of this teleconference, but we can reach out to people specifically.
And I just put up our Asian Health email account. So if you have any further questions, feel free to email us. And I know the question came up about the presentations being available, as Dr. Wang mentioned, we will have that available. So if I don't see any other questions, we will close out the session. Again, thank you very much for your participation. Feel free to reach out to us with any further questions and enjoy the rest of your afternoon.
Thank you all.